5 minutes.
Thank you very much, Mr. Chairman. I do appreciate it. This committee had significant concerns about and accordingly extensively studied the Navigators program in the previous administration, and I would like to introduce into the record the following letter sent by the committee in 2013. An April 12, 2013 letter to Secretary of HHS Kathleen Sebelius, a June 28, 2013 letter to then Secretary of HHS Kathleen Sebelius, an August 29, 2013 letter sent to 51 grant recipients in 11 states that received 61% of Navigator dollars at the time, and a list of those grant recipients who received the letter, and a September 20th, 2013 letter to then Deputy Administrator and Director of the Center for Consumer Information and Insurance Oversight, CCO, at CMS, Gary Cohen. May that be admitted without objection?
So ordered.
During plan year 2017, Navigators received more than $62 million in grants and enrolled only 81,426 individuals, less than 1% of the total enrollees, but at a cost of over $750 per person. By contrast, agents and brokers assisted with 42% of federally facilitated exchange enrollment for the plan year 2018, which cost the FFE only $2.40 per person or per enrollee to provide technical and training assistance. So, Mr. Weisky, I have questions about whether we should, be putting more good money after bad results. H.R. 1386 would redirect $100 million annually to the failed Navigator program. Based on your experience in Wisconsin, can you speak to whether the Navigator program was a good investment for taxpayers there?
Yeah, look, what we saw in the state is if you look at the other lines of insurance, they've moved away from sort of the face-to-face. They've moved into different methods to get customers. And while Navigators have some value, certainly in certain populations, I don't think we had a feeling that they had a strong presence in our rural communities that were also largely uninsured and in other spots. So, we felt that agents were much more effective and that there are other methods to encourage enrollment.
Thank you. During your time as Deputy Insurance Commissioner of Wisconsin, did Wisconsin experience any fraud, waste, or abuse within the Navigator program?
So we had a number of cases that we had to investigate, mostly people who were posing as Navigators who were not in fact Navigators that had problems. We didn't actually have any problems. We had So
you didn't have any problems with the real Navigators?
Real Navigators.
It was
we
with
had
the fake
problems
Navigators.
with fake Navigators, correct.
All right. And based on your experience with the Navigator program, do you believe that redirecting $100 million annually to the Navigator program, as H.R. 1386 intends to do, would be a wise investment for the taxpayer?
I think we're hoping to encourage more flexibility in the way consumers can sign up for coverage to get them where they actually buy coverage today.
All right, I appreciate that. I did think it was interesting to note that several of my colleagues have talked about the cost of the insurance. Mr. Lee spoke about 85% in most of the federal markets. The price has gone up in the states that have their own markets. That's less than half of that, about 39% in his written testimony. And that this really affects the middle class family, the average family that are above that 400% of poverty level rate. What's interesting about that is that when this plan was being discussed, and it's one of the things we have to look at when we're looking at the new promises to lower rates, people of my district were promised that the president came to the district when he was campaigning and said he was going to reduce the average cost of health care for the average family by $2,500 a year. And now we're talking about if we pass new bills, we might get a 7% reduction and an 85% increase. Clearly, we're not anywhere near the goals that this plan promised. And we are experiencing, and my constituents complain all the time, and so I appreciate you mentioning that, Mr. Lee. Their co-pays have gone up, their out-of-pockets have gone up, and their insurance premiums have gone up, and they have just been hit hard, and it's a whole lot more expensive than what they were facing before Obamacare. Hopefully we can find some bipartisan resolutions to bring down these costs, but I don't think that it can ever get to that point where the families actually see, average American family sees a reduction under Obamacare, as he promised at Virginia High School in my district, a $2,500 decrease. I yield back.
Ms. Kelly?